My name is Dennis, and I was diagnosed with adenocarcinoma of the head of the pancreas in February of 2023. I initially got treatment at Stanford by the oncologist there and had a number of regular chemotherapy sessions that proved to be not very successful, although they succeeded in making me feel quite ill. Then, after I had a discussion with the oncologist, he and I both agreed that my treatment was not going very far or getting anywhere. And so I started looking around to see what else was available. And I read an article that was written by Dr.V, and the article led me to her website. And the website was quite interesting and informative. So I decided to give her a call and set up an initial appointment. And that was last summer, so I went through about 3 months of on and off treatments with Dr. V, doing low dose chemo, potentiated by insulin, which is an interesting approach, and it seemed to be quite successful over time. The good news is that my tumor has subsided significantly, and I don't know if there's any real activity going on there or not. We're in the process of re-evaluating it right now. What's good about integrative and alternative care is that there are so many treatments modalities available now that normal oncology does not speak to or address. And when you try to bring them up with the regular oncologist, most oncologists that I've ever spoken to don't want to hear about it. So it's very interesting that there are a few doctors around who are doing integrative oncology, and this service is really important and needed. I decided to use Dr. V and to come to her clinic on a trial basis because really I had no other options at the time that were clearly better. And the instructive videos that Dr. V has made that I was able to view online helped me really to understand that she had a good perspective in cancer care. So it wasn't difficult to decide to use her as a resource and come to her clinic. It's not the only thing that I do. There are a number of people doing amazing work now in cancer care, including using supplements to help keep the tumor from growing, essentially. So those are all positive things, and Dr. V seemed to fit into that alternative mode really well and be really available and helpful. Well, most importantly, it's important to understand that regular oncology is not the answer to a lot of patients' problems. it's unfortunate that regular oncology has blinders on, but they're very concerned about having double-blind controlled studies to document uh, what works, what doesn't work. And of course, there's the insurance companies that have to pay for a lot of this, and that insurance money dictates a lot of what the regular oncology doctors can do and will do for you. Recognize that your health is your responsibility, not anyone else's. And you can either go with treatment or not, depending on if it works. Mine wasn't working. If my treatment had worked successfully and was an amazing treatment program that started initially at Stanford, I wouldn't come here. The problem is so many times that's not the case. And the testing that Dr. V is able to do with the RGCC laboratory has proven very valuable, that I've discussed with some of the oncology docs, including a surgeon who wishes that everyone could have that testing done. My comment was, why doesn't everyone get the testing done? And of course, there was no answer to that at this point. So, different new therapies start small and gradually catch on, and then eventually they're recognized as having value and working. The problem is it can take many years for the old guard that's set in their ways to change their perspective and recognize that a new approach may be more valuable. So that's why you should look into alternatives. Well, I think it's quite well controlled. We're waiting for some testing to come back, but my cancer markers, the blood tests that you have done, have gone from a high in the 7,000s to around 200. And I'm hoping that they continue to come down. So I'm in the treatment is a process, and I'm in the middle of the process. I've gotten the low dose chemo out of the way, but now there's other options, including a dendritic vaccine that I will hopefully be able to take later this year and continue to be successful. Cancer is not something that's an acute illness. Cancer, you have to think about as a chronic illness that develops for whatever reason that people bring with them or carry with them and have to deal with through their lifetime. That's what seems to be the reality of it. So it has been successful, and to date, and so I'm hoping that it continues and that she continues. So take good care of her.